Afternoon all, I'm Dr. Varun Saini. I'm going to present on a new design, new standard, RayOne aspheric hydrophobic IOL. So the salient features of this lens are that it's made of a new generation hydrophobic material with a water content of less than 3%. It has an ultra glistening free material with aberration neutral aspheric optics. It has a new design with unique cornerstone tabs. It has an anti-vaulting haptic design and comes in a fully preloaded form. The glistenings are fluid-filled micro vacuoles that form within the matrix of the lens when it is exposed to an aqueous environment. They can cause scattering of light, impacting contrast sensitivity and creating visual disturbances. In an independent comparative study, 5 lenses of different companies were subjected to in vitro aging procedures designed to simulate clinical conditions, and the level of glistenings was evaluated. The report concluded that the RayOne lens showed high resistance to microvacuole formation and is equivalent or superior to the best hydrophobic lenses currently available on the market. So this graph shows that the microvacuoles per millimeter square was the least in the Rayner group. The images in 90x magnification also show that glistenings in 800C were virtually unseen. Coming to the optics, the monofocal lenses can be aspheric or they can be spherical lenses. The aspheric lenses come in aberration neutral technology and aberration negative technology. So we all know that the cornea has an inherent spherical aberration of plus 0.27. If we use a spherical lens, it will increase the spherical aberration, resulting in a poor quality of image. The aberration negative lenses neutralize this corneal aberration completely, resulting in a sharp image. However, the depth of field is reduced. This aberration neutral technology preserves the inherent corneal positive spherical aberration and results in a good image with a good depth of field. It offers improved contrast sensitivity and better low light visual acuity than spherical lenses. They offer more depth of field than aberration negative lenses and are less susceptible to the effects of decentration than the aberration negative lenses. The study reported that twice as many patients preferred the aberration neutral IOL than an aberration negative IOL. And also 3 times fewer reports of visual disturbances was noted with the aberration neutral IOL. Here we can graphically see that the MTF values markedly reduced in aberration negative optic lenses when decentration occurred. However, the MTF values remained more or less stable in aberration neutral optics. So the aberration neutral lenses showed less sensitivity within a wide range of displacement and provided better results. Now these cornerstone tabs, which are present in the optic of this lens, they ensure that the lens is perfectly balanced as it travels down the injector nozzle. Once in the eye, its anti-vaulting haptics lock against the unique cornerstone tabs for the superb stability in the eye. Also, it has a 360-degree Amon-Apple enhanced square edge also at the haptic optic junction, which creates an optimum barrier to reduce the epithelial cell migration. This results in minimal PCO rates of even less than 1.7% at 24 months. So it's a fully preloaded lens, and this injector is a true 2-step system. The first step is just put the OVD inside the port in the cartridge. The second step is just lock the cartridge and you're good to go. It has a single-handed plunger with minimal force required. It has a unique lock and roll technology which rolls the lens inside the injector for a single smooth movement. The nozzle size is 1.6 millimeters, so it can easily be used through a 2.2 millimeter incision. So it is the smallest fully preloaded injector nozzle. It is parallel-sided, which maintains the incision architecture, and it is very ergonomic and very smooth in handling. In a comparative study of 6 market-leading preloaded delivery systems, RayOne received the maximum score on the ease of use scale among all the lenses, and it also had the least time to complete the lens implantation among all the systems. This is a small video showing the lens implantation of this lens. So this phaco has been done via 2.2 millimeter incision. So the lens has already been locked. We just push the lens into to the tip of the cartridge. The injector goes very smoothly through this incision, and the lens is injected directly into the capsular bag in a single smooth motion. The leading haptic goes into the capsular bag. The lens opens very smoothly in the correct orientation, and then the trailing haptic is guided gently into the capsular bag. last slide. So to conclude, this Rayner lens is an excellent aspheric hydrophobic preloaded IOL. It is available in a wide range of powers from -10 to +32 diopters. It is glistening free, offers a high contrast sensitivity and depth of field. It can easily be used through a 2.2 millimeter incision, and it is one of the easiest and smoothest preloaded IOL system currently available. Thank you.
Thank you, Dr. Varun. I think it is a very nice talk, and whether it is a hydrophilic or hydrophobic platform, the Rayner's, I can tell one of the #1 intraocular lens in the world, because as we know that Rayner is the first company to manufacture intraocular lens for the overall ophthalmology. I think every product from Rayner I have used in hundreds of numbers, and the results are just fabulous.
Yes.
Thank you.